Provide foot care to a resident. Introduction. Foot care is performed at the direction of a nurse according to the care plan. Foot care provides CNAs the opportunity to inspect all surfaces of the feet while you are washing them. The skill for foot care involves washing, rinsing, and drying the foot, and applying lotion to the entire foot except between the toes. The whole purpose of this is to look at the patient's feet for red areas, wounds, bruises, cuts, rashes, or any other abnormality. CNAs are not permitted to trim, cut, file, or clean under toenails. If a patient needs toenail care, you will need to notify the nurse. A podiatrist or foot doctor comes to most facilities once a month. When a CNA notices the patient needs toenail care and notifies the nurse will put the patient's name on a list of patients who need to be seen by the podiatrist. Why? Patients with poor circulation and/or diabetes are at risk for developing wounds that won't heal, often resulting in infections or even amputations. This is especially common in feet. When CNAs cut toenails, they can accidentally cut the skin around the toenail, causing a wound that doesn't heal, or cut the toenail at the wrong angle, causing it to grow into the skin, also known as an ingrown toenail. Nail clippers should never be used by a CNA. What are we looking for? Any red area, blister, wound, bruise, cut, rash, or anything else that looks abnormal. These pictures illustrate some common abnormalities that may be seen during foot care. For the state test, you will only be required to perform foot care on one foot. The evaluator will have the patient sitting in a chair by the side of the bed. The care plan will indicate which foot you should perform foot care on. Pay close attention to the care plan. Gloves are considered optional for this skill. If the patient's skin is intact, you do not need to wear gloves. If the patient has cuts, rashes, wounds, or any other abnormalities, you will need gloves. Because you often do not know if the patient has any skin issues until you begin cleaning, it's best to wear gloves when performing this skill. You will need to place a barrier on the floor under the patient's feet before getting the basin of water to soak the patient's foot. This prevents the floor from becoming slippery if water spills. It also provides a clean place to put your clean supplies. When filling the bath basin with water, use a paper towel to turn the faucet on and off. Your hands will be clean and the faucet is dirty. And check the water temperature with the inside of your wrist. The water should feel warm, but not hot. Since this is a washing skill, you will need to ask the patient to check the water temperature before you put their foot in the basin, to make sure the water is comfortable for the patient. In a clinical setting, you would allow the patient to soak his foot for 5 to 10 minutes. However, the test does not require you to soak the foot before cleaning because of the time limits that you have during the test. After the patient has soaked their foot, you will remove the foot to wash it, supporting the leg at all times as you move it. You cannot add soap to the basin, only to the washcloth you are using to clean the foot. You will then return the foot to the basin for rinsing. Remove the foot after rinsing and set on the towel to dry. Make sure you dry the areas between the toes thoroughly. Always warm lotion in your hands before applying to the patient's skin. You will apply the lotion to all areas of the foot, paying special attention to the heel. Look for cracks or dry areas and report these to the nurse if found. Do not apply lotion onto any areas of the skin that are not intact. Do not apply lotion between the toes. Lotion between the toes will trap moisture in this space and may lead to a fungal infection. Remember, warm, dark, and moist is the ideal environment for bacterial growth. Once lotion has been applied to the foot, wipe off any excess lotion with the towel and put the patient's sock and shoe back on. If the patient has a skin issue that needs to be reported to the nurse, notify the nurse before you put the patient's sock and shoe on, so the nurse can quickly assess the problem. Watch the instructional video for step-by-step instructions on how this skill is performed. Then watch the demonstration video, which demonstrates this skill performed in a testing setting. When you have watched the videos, try this skill on your own.